Good morning all. Today we'll be learning about the third class on the pharmacodynamics. Hope all of you are hearing me. Yes, all of you are hearing me. Okay. So what is this adverse drug reactions? What are the agents which will cause this adverse drug reactions? All these things we'll be learning today. So this is the third part of this pharmacodynamics, where we'll be learning about what the drug is doing to the body. With that, we have learned some of the good effects now, and how these good effects or bad effects are brought by this receptors. Now we are learning about the adverse drug reactions. So coming to the first slide, to understand, it is always the benefits and the risk will be weighing in the weighing machine. Okay, so if the benefits are outweighing the risk, then only we are administering these drugs. So this whole chapter or whole class will be about this. What will be the benefits we receive and what we are risking. Okay, with this idea, we'll move further. So what is adverse drug reaction? So adverse drug reactions is any untoward medical occurrence in a patient administered to a pharmaceutical product, which is suspected to have a causal relationship with this treatment. That means in adverse drug reaction, there should be a causal relationship between the drug administered and the pharmaceutical product. So a response to a drug which is noxious, unintended, and which can occur at doses normally used in none. So it is noxious, that means it is causing harm, and it is unintended, which is occurring at a normal dose. So spontaneous reports from the consumers and the healthcare professionals can be regarded as suspected PDRs. So we have two terms here, adverse drug reaction and adverse events. So what is the difference between adverse event and adverse drug reaction? So there in between a drug is there, that means all those pharmaceutical products which can cause this reaction, we call it as adverse drug reactions. So all those adverse events are those which can occur with the excipient, or it can occur with any other agent other than the pharmaceutical product. So adverse event is any untoward medical occurrence that may present during treatment with a pharmaceutical product, but does not necessarily have a causal relationship with this treatment. Then coming to the serious adverse events. So adverse events that is either life-threatening, fatal, and cause prolonged hospital admission, we call it as the serious adverse drug event. So it can cause this persistent disability on long-term usage. So here we are trying to understand difference between the adverse drug reaction and adverse event. So here within the yellow circle, what we are seeing is due to the drug reaction or due to administration of the drug. So adverse event is a bigger term which can include the reactions which occur in the body with the diet. For example, you have taken a fish which was exotic, you got reaction. It can be the peanut, all these things can occur. So there are so many factors which influence the diet also, the oil which the person has used, environmental allergens. The patient may have problem with the complaints that can cause allergy, genetics, diseases. So many things can cause this adverse events. But few of them are due to the drugs. We call them as adverse drug reactions. So this type of reactions can be seen with the use of the contact dermatitis like thing. Okay. So here also there is a sign of contact dermatitis like allergy. It can be due to allergic chemicals which were used in this bracelet. So these are all the types of the adverse, how it presents to us. So starting the earliest sign which we will be getting is the swelling up of the upper lips, lower lips, and itchy lesions, wheal flare, sweating, all these can be seen. So later, after visual changes, later there can be changes with the laryngeal and pharyngeal edemas. So laryngeal edema in its severest form, where where the person will be having stridor or very much difficulty breathing. So coming to the ADR database. So when ADR started, how we have proceeded, what are the steps we have taken. So this is the famous photo which is showing us phacomelia, which is due to the thalidomide, which was used for morning sickness. Morning sickness means the hyperemesis gravidorum thing, which the ladies will get in the first 9 months of the pregnancy. So this thalidomide was used as a drug which can suppress this pregnancy-induced vomiting. And most of this occurred in UK, where most of the females were working in industries, so they had to go to the work with this hyperemesis, where they were feeling difficult to work with all those symptoms. So once they started taking this thalidomide, they were able to suppress the vomiting or nauseating feeling. And later, when they delivered the baby, they had these club foot and club limbs. So this was a tragedy. So there are various drugs which are withdrawn from the market because of this adverse drug reactions. We have this tegoserot 2007. It was removed due to the cardiovascular ischemic event. Then we have this coxib or selective COX-2 inhibitors, which was removed from the market in 2005 because of the dermatological events. So you can see valdecoxib, profecoxib, they are not there in the market. Then we have this serivastatin, which caused this rhabdomyolysis in 2001. It was removed. Then we have this so rofecoxib is there. Then we have this fatal arrhythmia, which can be caused by levomethodol, cisapride, which was cisapride, mozapride. These are all the prokinetic drugs which cause this cardiac arrhythmias. So we had this thalidomide tragedy in 1961 with congenital malformations. Then chloramphenicol, which caused blood dyscrasis, or we stopped using it after gray baby syndrome. So chloramphenicol is still the reserve drug for typhoid. Flecainide is a drug which is commonly used as an antiarrhythmic drug. But it itself can cause arrhythmia, so its use is stopped now. So many drugs are there. So if we come to the classification of this adverse effects, we have this type A, type B, type C, and type D as a major classification. So type A is augmented, most common type, where the pharmacological mechanism based reactions will be there. For example, the person this drug will be used for the antacid properties. So the augmented action will be based on the antacid properties, that is decreased food absorption, or not able to kill the bacteria because there is suppression of the acidity. Then type B or bizarre reactions. So major type of reactions here we see, because again type B reactions are further subclassified. So type B reaction is a short notes for you. We call it as a patient reactions. So immunoallergic reactions, peculiarities here is idiosyncrasy, drug dependent, which is actually not related to the mechanism. That is the peculiarity here. Okay, so less common, not those related, unexpected. So casualty will be uncertain, no reproducibility will be there. So anaphylaxis with penicillin. And also penicillin might not have caused reactions in previous 100 administration, but in 101th administration, they can get anaphylaxis. So type C reactions, adverse effects, we have this statistical effect. So often long latency mechanism here is unknown. So difficult to reproduce experimentally. So benzodiazepine dependence, analgesic nephropathy, these are related actually to the long-term drug therapy. So type D reactions refer to teratogenic or carcinogenic effects. Then we have this type E reactions or end of dose effects. Like if you are using the antihypertensive drug for a long time, after stopping that drug, immediately the hypertension will be aggravated. So something like a withdrawal reaction, it will be there in the opposite way. So propranolol, after you use it for a long time and stop it, we will get hypertension. So that is end of dose effect. Then type F is failure of the drug therapy. That is when we are using the anti-tubercular drug without complete cure, then we call it as a failure of the drug therapy. So these drugs can cause reactions. Then severe, based on severity, how we can treat it. Minor reactions, we may not be taking it seriously or not admitting the patients for treatment. Moderate, yes, so here we will be administering specific drugs, starting with the specific anti-allergy drugs, antihistamines, adrenaline, all these things will be given in moderate. Severe, potentially life-threatening. So here we will be using this adrenaline again. So prolonged hospitalization may be required. Lethal directly or indirectly lead to the death. So based on the reactions, we use the treatment modalities. So this erythema multiforme is a type of skin adverse drug reaction. We can see it due to penicillin. Erythema nodosum, we can see it due to sulfonamides, or we can take it as a DAP zone in leprosy. We get this exfoliative dermatitis. Again, the sulfur drugs can cause this. Gold salts, carbamazepine, all this can cause. Coming to the pemphigus, again penicillin and rifampicin can cause. So coming to the urticaria, it can be caused due to the codeine, dextron, penicillins, all these things. Then type A, that is augmented. We have the side effects which are we call them as side effects which are unavoidable and unpredictable. Here it is due to the we know that it is due to the extended spectrum of the action, or it is based on the mechanism of action we are getting this disease. So occurs at the extension of the same therapeutic effect. So we have this atropine for which can cause this dry mouth, promethazine causing sedation, estrogen causing nausea. Then indirect consequences of the primary therapy, that is immunosuppression is there, means we will get this oral candidiasis or oral thrush. So toxic effects on overdose, the manifestations are predictable and dose related. Atropine can cause this delirium. Paracetamol can cause this hepatic necrosis. So we can use N-acetyl cysteine for that. So this barbiturate can cause coma, or due to the respiratory suppression we get this. Morphine can itself can also cause respiratory failure. So morphine, the analgesic action is directly proportional to the respiratory depression. Type A, augmented intolerance, appearance of characteristic toxic effects of the drugs in an individual at therapeutic dose. So here it is at a therapeutic dose. So opposite of tolerance. So sensitive to, even the person becomes sensitive to low doses. So few doses of carbamazepine, they can cause ataxia, defective movement, goiter, all these things can be seen. Then coming to the type B, or bizarre or idiosyncratic type of reaction. So it is a genetically determined type of reactions. So abnormal reactivity to a chemical, they can cause these reactions. So these are atypical. So barbiturates, streptomycin can cause this type of reactions. So these drug allergies are immunologically mediated, producing stereotypic symptoms which are unrelated to the pharmacological profile. So here it is independent of the dose. So type B, bizarre reactions. Here the dose, if they are not related to dose. We have this type 1, type 2, type 3, and type 4. So type 1 is the common one what we see, that is anaphylactic type of reactions. Type 2 is cytotoxic reaction. Then we have this type 3 reaction, that is immune complex mediated. Type 4 are the delayed type of reactions. So type 1 anaphylaxis or immediate hypersensitivity reaction. The drug or a metabolite interacts with the IgE molecules fixed to the cell, particularly the tissue mast cells and the basophils. So this triggers the process, and that can lead to the release of the pharmacological mediators like histamine, 5-hydroxytryptamine, kinins, arachidonic acid derivatives. All this. So manifestations here are in the form of urticaria, rhinitis, bronchial asthma, angioedema, and anaphylactic shock. So I think here it is not allowing me to continue. I will again start the class.